Good afternoon all. Please take a seat. Just to set the stage as well, I think for the people who know us on this panel, this is a very emotive subject for us. We decided to choose a panel that really transcends across both the regulator, the specialist in geneticists, and the clinician who are serving our patients through the data that's been provided, to give the audience a really big spectrum of how impactful a program like this can be on the healthcare ecosystem and on our citizens. But just to start, to give some context, the Emirati Genome Program is a very unique program globally. Most POP-Gen programs are research-based with very little utility in clinical applications. The vision that was set for this program from the leadership and the Department of Health was how we take this information and bring it from a population genome program to an individual personalized program. And main factors driving those strategies was really the disease burden. The prevalence of rare diseases, the prevalence of comorbidities, chronic diseases in this part of the world is very high to other nations. So this needs to be addressed from the root, and this program helps to address that. So my first question is to Dr. Mohamed. As the regulator, what do you see to be the burden of disease here in the United Arab Emirates, and how do you see Emirati Genome Program addressing that?
Thank you very much, Baran. First of all, thank you very much for inviting me with these esteemed panelists. So at the Department of Health, before I answer your question, at the Department of Health, we have three main goals. So the first is to have healthy population. Second is to have the best healthcare globally. And the third is sustainability and innovation. So in order to reach those goals, we needed a program such as the Emirati Genome Program. So to answer your first question when it comes to the genetic burden, there are some diseases that we knew even before the Emirati Genome Program that had some sort of a burden on our system. However, when the Emirati Genome Program came, the picture was much clearer. We knew exactly what are the, let's say, the genetic burdens or the genetic diseases that we are facing within the population. And in addition to that, we had programs that stemmed out of the Emirati Genome Program, such as the premarital genetic screening, newborn genetic screening, that kind of like guided us, that gave us the data that as a regulator would help us to be a data-driven regulator when it comes to being agile. We make sure that we have the proper guidelines, proper policies and standards that will make it easier for the doctors and clinical geneticists to do their job in order to prevent, diagnose, and treat those patients.
Thank you, Dr. Mohamed. So now I move to our clinician, Dr. Ghadeera. As a cardiologist and someone who has a keen interest and an SME within cardiac predisposition, genetic predisposition, how have you seen the support of having such a data set like the Emirati Genome Program, whole genome sequencing, help you in diagnosis and reducing that diagnostic odyssey? As we know, the average diagnostic odyssey globally is for rare diseases is 8 years. And how is this data and this diagnostic odyssey being reduced through this data set?
Thank you very much. This is an amazing panel. This is actually, I consider myself among friends because my colleagues are the team that we've been working on the cardiovascular genetic program for the last 2 years. Actually, the Emirati Genome Program and working with regulators like Dr. Mohamed Alameri and my colleagues, Dr. Val and Dr. Azza, has enabled the access of undiagnosed and uncharted territory of cardiovascular genetic diseases to be unmasked, diagnosed, and as my colleague Dr. Mohamed has mentioned, walking it through the preventive, the diagnostic, and the treatment options. And very soon, actually, with much more preventive measures like premarital being part of the premarital screening for some pathogenic variants, and designing and being part of the precision medicine for such conditions. So the collaboration with the Emirati Genome Program through the regulators actually has enabled unmasking many of the cardiac diseases in the Emirati families. We've been struggling with some conditions. We've been struggling with some conditions which we didn't have enough data to support our diagnosis, and thankfully to such access to such programs, and actually the enthusiasm of the regulators to set up a cardiovascular genetic program, and the support from our colleagues from the laboratory side and scientific side, we were able to diagnose those conditions. We were able to map what's the most common cardiac conditions here in UAE and provide a diagnostic mapping and guidelines. We were very thrilled and happy to launch the cardiovascular genetic guidelines, practical guidelines for the Emirates of Abu Dhabi in August 2024. So I hope I answered your question in regard to the access and enabling Emirati families to that program.
Thank you, Dr. Ghadeera. And just for the wider audience, Dr. Ghadeera is really supported building the guidelines regarding cardiovascular disease genetic testing. She helped us build the panels with the Department of Health that is specific for our population here in the UAE. And this is something that is quite unique, is that we're able now, through the data that we have and partners in the ecosystem, truly develop personalized panels that are specific for our population. So I'll thank you for that. And Dr. Ghadeera, just maybe as a quick follow-up, can you give us a real-life example of a patient of yours and how they benefited from this data and this diagnostic odyssey?
Certainly, certainly. So as we were working on the cardiovascular genetic guidelines, we were faced with a very sad story of a 15 years old who died suddenly of Emirati nationals. And to be honest, I was very happy to communicate that to my colleagues at the Department of Health from a regulator point of view to help advance and implement the cardiovascular genetic guidelines, and to my colleagues, Dr. Val and Dr. Azza, to expedite the process of testing and reporting. And for the first time, we were actually able to diagnose the patient who suddenly died, and we were able to diagnose the condition in his siblings, almost 4 siblings, and we were able to diagnose that in the parents, the father and the mother. And because of it's an Emirati Genome Program and collaborating with that, we extended that to most of the first degree relatives, and I consider that a success story where family were initiated immediately on treatments to prevent sudden cardiac death.
Cascade testing, that's a very important part of the clinical workflow. And I think that's underrepresented in the way we address disease, diagnosis and burden, is that we need the mechanism for cascade testing to ensure that genetic diseases are inherently diagnosed, but more importantly, managed in other family members as well. So that's a very valuable point. I would like to add a use case, Dr. Ghadeera, that we actually experienced on the Diagnostic Odyssey. We had an Emirati patient that spent 8 years traveling the world trying to be diagnosed of a rare disease that was misdiagnosed for 8 years from the best hospitals in the world. And he came back to the United Arab Emirates and he participated in the Emirati Genome Program and requested a clinical genetics test. And we diagnosed him within 2 weeks with a rare genetic disorder. He was then managed with particular targeted therapy, and that stopped him from having to have a kidney transplant. That's just one small example of 8 years of misdiagnosis, and just because of the access to data, he truly benefited as an individual, and inshallah will benefit the society as a whole. Thank you, Dr. Ghadeera. Dr. Azza, genomics, every week, month, year, there's new innovations, new updates. It's hard for us to keep up as people working in this discipline. So how are you supporting our clinicians who have to keep up with their own discipline to worry about your discipline, keep up with the genetic updates, how they can have access to these new tools and innovation to support their clinical practice?
I thank you for this invitation and for this panel. I think the Department of Health and Abu Dhabi Preventive Medicine played a big role in raising the awareness of the population and the clinician for genetic tests. So before starting any program, we were doing a kind of training for the physician task force who will be facing, because we don't have enough geneticists and we don't have enough genetic counselor in UAE, not only in UAE, but all over the world. So the implementation of such kind of training for those physicians using the local available facility like UAE University, we did a very good training for the physician for premarital screening. It was under the help of DOH and Abu Dhabi Preventive Medicine. Also for newborn screening, which will start soon, the program Genetic Newborn Screening, we also upskilled the physician for such kind of how to do the pre-counseling and the post-counseling. We are also on the ground with them. Whenever they need help, we are providing them advice, whether by phone call or by meeting them personally, by doing a workshop with them as well. And of course, we are updating ourselves as well, because genetic is expanding, as you mentioned, every day. So we need to be up to date by attending conference, by reading articles, continuous education. It's a continuous process, and it needs time, but I think the trigger was the Emirati Genome Program. This was the trigger of the education of the whole population, and especially physicians.
Thank you, Doctora. I have a sort of reflection on this as well. I know the leadership and the Department of Health are significantly focusing on genomic literacy within the public domain. But I believe there also should be a focus on genomic literacy within the clinical domain as well. And I think, to your point, Dr. Azza, this is started with Emirati Genome Program as now integrating genomics as a standard of care. Building that literacy within our clinical pathways, in our public health initiatives, as well as our diagnostic and clinical pathways, is very important to really take the best out of the data that we have available to us, this rich data source. So with that, if we look at now what we coined as the 3 Ps, the predictive, preventive, and precision care models. The preventive and predictive care models depend on public health policy. So, Dr. Mohamed, from your perspective as the regulator, how are you utilizing this data set to support public health policies? And I know there's very successful programs, and I'll let you talk about those, but if you don't mind, just educate us on these public health policies and where you see the benefit to our population and the future outcomes.
When it comes to public health policies, let's say the challenge that we're facing at the moment, as you mentioned, genetics changes maybe daily, if not hourly. So we need to be very agile to make sure that we're including as many screening programs as possible using the Emirati Genome Program. For instance, we have the premarital genetic screening that was implemented, that was mandated this year, beginning of this year, around the country. This kind of gave us like an insight of what are the most common, let's say, diseases that we are predicting for the next generations. So this made us aware that our policies need to change in a way that we are capturing everything that we are seeing at the moment. And not only premarital genetic screening, there are other programs that are the routine screening, let's say for FHAS, that we have at Abu Dhabi, including genomics within these kind of programs will give us that idea of where should we head when it comes to policy standards and guidelines. And in addition to that, we are adding the multi-omics side to it as well. So having that kind of like 360 view with the phenotypic data would tell us exactly where we are heading. We know where we are now, but we need to make sure that we know where are we going to be in the next 10 years. So that's how we think about it from the regulator perspective.
Perfect, and I think Dr. Mohamed's being very humble here, because some of the programs that he described very briefly are extremely impactful. The premarital screening, for example, has identified 8% of non-compatibility. But again, what has been offered here is counseling, awareness, and then if the couple want to continue the marriage, IVF as well. The Department of Health and others have predicted that the next generation of Emirati citizens, there should be around a 75% reduction in all rare inherited diseases, genetic rare inherited diseases. That to me is a massive achievement by implementing such program that was only capable of being implemented because of the data that is part of the Emirati Genome Program. So going to the data now, Just to give context to the non-geneticists in this room, a whole genome sequence is around 3.2 billion data points and 23,000 genes. And for us non-geneticists, when we walk into a hospital and ask for a genetic test or get a genetic test requested, usually the clinician is looking at 100, 200, 300, maybe 400 genes. So imagine this amount of data, the sort of comprehensiveness and complexity of this data. So Dr. Ghadeera, from your perspective, where do you see the opportunities and also the challenges of trying to integrate such complex data sets within the clinical work pathways and clinical workflows?
I believe it will be achieving a database or a data set for, in my field, in the cardiovascular genetic, will be an amazing opportunity to dictate the future treatments and precise treatment for some of the most complex cardiac inheritable conditions. And it will actually pave the way for more advanced treatment, gene therapy, targeted therapy, more biological targeted therapy, which have been really in the progressively increasing and advancing. But I think data sets and database in inheritable conditions, and I would focus on the cardiac conditions because it will actually help building, as you mentioned, now there is an option of an IVF. It will actually enable new generations to be disease-free of inheritable, costly conditions.
I think there's underestimated the health and socio-economic impact of such programs. And I would love to see, I'm sure the DOH has these numbers, but they're hiding it from us, but I would love to see the true impact it has on our society, both from an economic and social perspective, because I truly believe there is a significant impact these programs will have. Now, these programs are only able to happen through innovation and scalability. So Dr. Val, as the medical director of our clinical arm for the Emirati Genome Program, it is your responsibility to constantly look at ways to scale. We started off with a small pilot back 2 years ago doing 50 BRCA panels or 45, I can't remember the exact number, but a very small number, to now last year doing nearly 50,000 diagnostic reports in 2 years. That is a massive way of scaling this program. So where do you see the innovation and how do you see AI being augmented and integrated into the pathways of what we do as a clinical geneticists and molecular biologists to help scale and innovate what you do every day?
Thank you for inviting me here. I would like to touch a few aspects. First, obviously, we were building our lab on the Emirati Genome Program, and as it was already mentioned, it's a clinical grade program, so it was easier for us in a way, because the first step what you do when you build clinical lab, it's quality. So you're making sure that your lab is really goes in accordance to the international benchmarks such as ISO and CAP. Then you build the clinical bioinformatics pipeline, then you build the team, you train the team, you work with regulators, making sure that whatever you do is in accordance to the international local laws. Then, as Dr. Azza mentioned, you work with the physicians, you upscale them, you work together, then you build clinical report and make sure that it's understandable. Then to increase the scalability of program and efficiency, you must to have AI addition, because starting from the clinical interpretation, AI helps significantly to make sure that what you report it, because when you do massive screening program, you have to have short turnaround time, but you have to have efficient, you have to have reporting with a high quality. So AI will definitely shorten time to evaluate the significance of clinical variants, because I'm coming from the old school. Many years ago, and we were starting not with the AI, it was a piece of paper, and you were sometimes spending 2 hours characterizing pathogenicity of a particular variant. So AI is extremely important to cut the time for variant interpretation, then to produce automatic reporting. And obviously analysis of the data, because the data which we produce is enormous. So then it does not have to be analyzed from the clinical perspective. We can add the aspect of medical importance, and also if we connect the data which we produce with electronic health record, so it will add additional level of complexity, but also improve the results which we're producing and make them more accessible to the clinicians.
Thank you, Dr. Val. Again, just to comment on some of your points, and I had this misconception as well when I started working closely with the clinical genetics team. It's like, well, you've identified these variants. It's a couple of days worth of work and you can issue a report. In reality, it's much, much more complex than that. And I think there's a misconception that, you know, you just run a whole genome sequence, there's a tool you put on top of it, it identifies the variants, and you're good to go. And Dr. Mohammed's laughing at me because I think that everyone has that misconception, but truly the amount of effort, manual work they have to do to go through public global databases, to look at classifications of variants, check the literature, to ensure that when they classify this particular variant for this particular condition, it is truly classified accurately or not. Sometimes they have to declassify, and it's days and hours worth of work from scientific community. So,
and I would like to also add genotype-phenotype correlations, because you always come from the patient and to the data, then you see how the data can help you to correspond to the clinical manifestation of the disorder.
thank you all. So we have unfortunately run out of time. I could have gone on for another hour asking questions. Again, it's a very important and emotive subject, but I'd like to thank our esteemed colleagues here on the panel, and thank you all again. Thank you.